Dr. Binura, thanks for organising this Zoom. So my name is Asiri. I'm a colorectal surgeon at Monash and Austin Health. And we do some collaborative projects with Dr. Lekamalage and Andrew Bowie in the Austin, as well as Medical Pantry, where we help support like CWM Hospital in Fiji. And the reason that for these visits are to support the Fijian population, as well as the Pacific Islanders with equipment and donations. But what's really striking is that the lack of access to services such as radiotherapy for patients where most patients as a colorectal surgeons, if they've got a locally advanced rectal cancer, they'll get radiotherapy and chemotherapy to downstage the disease. However, patients in Fiji and in the Pacific, they either don't get access to radiation where they have to have upfront surgery, or they get palliation because they're not able to access these resources. I've got a special guest who's a general surgeon and in CWM Hospital, and I'll put Dr. Delasau. We'll probably seek a bit more information from Dr. Delasau.
Bulavinaka, everyone. Bula Dr. Siri, Bin, and the team in Melbourne. Thank you very much for this initiative, Siri, allowing us to share our experience here in Fiji. I'm one of the general surgeons here in CWM Hospital in Suva. We look after over how many would the population?
900 total Fiji population. 900,000.
Yeah, about 900,000. The population of Fiji. We probably look after the Suva area, about 300,000 that we look after here in the Suva Nausori area. CWM Hospital is the main referral center for Fiji. We have Suva and two other hospitals, Lautoka and Lambasa. So most of their complex cases are referred across to Suva, on top of our 300,000 of the population that we look after. As a general surgeon, we look after pretty much most of the general surgical cases that cover thyroid, breast, all the GI cancers, upper and lower GI cancers. A particular interest for this recording is that we look after all the rectal cancers which need radiotherapy, as Dr. Siris alluded to. We don't have that in Fiji. There's no radiotherapy available. We only have some chemotherapy and surgery. The important thing here is one of our colleagues who is a consultant anesthetist, newly diagnosed with a quite locally advanced rectal cancer with involved nodes around the TME, threatening the CRM. Ideally, he would need upfront neoadjuvant chemotherapy, radiochemotherapy, which we don't have available in Fiji. And we are very fortunate and blessed that the team in Melbourne, Professor Glenn Guest and Dr. Shonal, who have close connection with Fiji, have offered to help our colleague with chemoradiotherapy on compassionate ground.
Yeah. And Dr. Ili, thanks for the information. And I did a bit of homework talking to multiple hospitals in Melbourne, and there's a lot of concern in Australia, where trying to offer chemoradiotherapy is very costly, including surgery. So it's great that we were able to get some on compassionate grounds, but there's a buffer that we need in terms of costing. And that's why we set up the GoFundMe to help if there's any complications, and to cover if there's any issues with chemoradiotherapy. So the reason was for people to hear firsthand, what resource constraints you're having, and,
Yes.
and to get this out there to the rest of the community and the rest of the world.
Thank you, Asiri. Thank you very much. The idea of the GoFund from you and your team, Bin and your colleagues setting up this GoFund page is really appreciated. Dr. Yeli and his family are very appreciative of the thought to try and raise some funds to help him. Yeah, understandably, as you mentioned, chemoradiotherapy is very costly. And even plus the surgery, that's an added cost, not including his obviously the travel and the accommodation while he's there. I understand that he'll need a long course chemoradiation for 6 weeks. I understand, and that will obviously be very costly for him and his family. And any help would be very appreciated by Dr. Yeli and his family.
And Ili, just before we sum up, like even breast cancer, the patients don't have access to radiotherapy. Is that's correct?
That's correct, Asiri. We in Fiji can only offer a mastectomy. That is obviously one of the main reasons is we don't have radiotherapy to offer breast conserving surgery. And also our patients in general present very late with advanced breast cancer, locally advanced and also metastatic. So we can only offer mastectomy, even at some stage just a toilet mastectomy for local control. And all these patients will definitely benefit from radiotherapy, even as a palliative treatment. You're right there, Asiri. I've got my colleague here, Asiri, who is a maxillofacial surgeon. Just briefly, just to get some of his thoughts on the cancers that he deal with.
Love to.
Yeah, Bulan. My name is Inosi. I'm one of the guys that does a bit of head and neck. So in terms of pathology cancers, we do about 2 cancers, oral cancers. Monthly, and for our population that's very high, and that's include just now we were just doing a revision on a guy that had a cheek carcinoma, so we did him it was last week, and we're just talking with Dr. Ili. We've got a lady that we resected. We did she had upper jaw maxilla squamous cell carcinoma, and now she's got a recurrence. Because we felt that if we had given a chance to get chemo and radio initially after the surgery, she would have had a better chance. And now she's come back with tumor coming through out of her face and posteriorly into the base of the skull. So in terms of operations, it's non-operable. Probably will go down the pathway of palliative. So those are the constraints that we also facing in terms of our services.
Yeah, I mean, we've been saddened by our visits to the Pacific Islands and Fiji. That's the lack of resources, even stoma bags, whiteboards, gowns, and all the other resources. So anyway, we hope this podcast will help to give some insight as to what things are actually occurring. So even though it's a paradise for, Fiji's sold as a paradise for tourists to enjoy the beaches and the oceans and all the holiday resorts, but in reality, it's not so much of a paradise for the Fijians who are living in Fiji. So hopefully, this podcast will help people to support your country and in particular your colleague who's struggling at the moment. Being early 40s with a locally advanced rectal cancer.
Yeah, Asiri. Thank you, Asiri. Thank you for your thoughts and your kind efforts to try to raise some funds for Dr. Yeli. He's just texted me saying that he apologized that he couldn't join the Zoom tonight. He's driving on his way down to Nandi now to leave tomorrow to fly to Geelong where the
Okay.
team there has kindly offered to do his chemoradiotherapy, hopefully starting this week. But yeah, any support for him and his family would be really appreciated.
No, amazing, Ili. Well, thanks to you and your team, and thanks to Dr. Binura and Dr. Glenn Guest and all the other team nurses involved. We hopefully we can help support CWM and the Fijian population. Thanks for joining.
Naka. Thank you.